Hi friends, have you heard the term vertigo or dizziness? It's so common in the population, said that up to 40% of the population will have the so-called dizziness at certain point of time. Vertigo is a term which encompasses the true spinning movement. Either the person himself feels that he is getting rotated, or he feels that the environment is getting rotating. So that's a terminology which we would call as a vertigo. There are empty cause for vertigo. It can be a peripheral cause. Peripheral means it is confined to the ear. So, the vertigo related to the problem in the eyes, in the nerves, in the cerebellum, the brainstem, in the brain, or due to various psychosomatic causes. Okay, so let me tell you initially, all the so-called vertigo are not true vertigo, because sometimes there is something called a pre-syncope or syncopal attack. The patient or the person might be feeling dizzy or will have blackout or graying of vision, especially once he gets up from the bed and when he starts to move or walk about. He feels that it's as though he is dizzy and he might fall down. This is something what we call as a syncopal attack. Usually it is caused by low blood pressure, especially in people with anemia, those who are taking various medication, diuretic, centrally acting medication, or maybe associated with Parkinson's or stroke and all. These people are prone to have this sort of syncope or low blood pressure causing dizzy feeling and falling down. That is a first cause for the so-called dizziness or syncopal attack. Secondly, you have true vertigo. True vertigo means he definitely feels that the environment is getting rotated. That's this common, especially when he turns in the bed, or when he rises from the bed, or it moves from one side to the other. The most common among them is the benign paroxysmal positional vertigo, or the BPPV. There are many types are there. This is due to the problem, the imbalance in the vestibular system. There are semicircular canals, anterior, posterior, lateral semicircular canals, utricle and sacral. There are various balance organs in our ear, and that would pass the information through a nerve called the vestibular nerve. This goes to the nucleus, vestibular nuclei, to the brainstem, and from there it goes to the brain, the superior temporal lobe. So any problem, it may be the brain itself, like the superior temporal lobe, like a vertiginous epilepsy. Some people with a lesion, with a locus of epileptogenicity or a tendency to have epilepsy, can have vertigo followed by a seizure or a fall or a generalized tonic-clonic fits. Similarly, there can be problem in the brainstem, because brainstem is your midbrain, pons and medulla. So many tracts and so many nucleus and other structures are there in the brainstem. Any lesions there would cause so-called giddiness or epilepsy, vertigo, probably due to stroke, maybe due to demyelination, other tumors or other granulomatous illnesses. Various drugs can cause so-called vertigo, especially anti-epileptic medication, aspirin, and even alcohol can cause vertiginous feeling. Or so even true vertigo can be caused by a high dose of alcohol or many drugs like aspirin, carbamazepine, phenytoin, phenobarbital. Many drugs would cause this called vertigo. Similarly, there are one tumor called cerebellopontinangular tumors. That is the vestibular nerve is getting compressed when it comes out of the brainstem and at the area where the cerebellum and pons are in proximity. Any lesion or any pressure or compression at this juncture would cause a feeling of imbalance, loss of hearing, as well as true vertigo. And if you take a scan, you would see there is a small tumor. It's called a CP angle tumors. Then there are conditions called labyrinthitis due to infection, some viral infection which would damage the inner ear. Similarly, Ramsay-Hunt syndrome sometimes can cause herpes zoster, can involve the otite, the inner ear, the 8th nerve, the 7th nerve and all, which would cause vertigo, dizziness or imbalance. There is one more condition called superior canal dehiscence, when there is a defect there, or trauma related vertigo, motion sickness related vertigo, and various decompression sickness causing vertigo. Yeah. There is one particular condition called Meniere's disease. In Meniere's disease, there is something called endolymphatic hydrops. There is a fluid accumulation in the inner ear. So what happens, the person would feel there is a fullness in the ears, they wouldn't hear properly, and there will be abnormality in the pure tone audiometry, and they would feel true vertigo lasting for 20 minutes or more. So true vertigo, vomiting, fullness in the ears and deafness, this the triad would encompass the term Meniere's. So the best treatment would be reduce the weight as well as restriction of salt and other medication, maybe some intratympanic injection as well. Then there are something called the disequilibrium due to multitudes of causes. Disequilibrium due to a peripheral neuropathy, nerve disease, problem with the ear as well as from the eye, the poor vision. All these things would interact and give rise to some sort of a disequilibrium. There is one more condition called triple PD or phobic postural vertigo. Usually people, especially all people, they must have had some vertigo in the past, and after a few months or years, they would feel that there is a constant tendency, fear of falling, something what you call a phobic vertigo. You just give them the sufficient counseling, physiotherapy and all, they would improve very well. The most important cause of vertigo to me would be a central cause like a problem related to the stroke or a TIA or vertebrobasilar insufficiency. How do you differentiate a peripheral vertigo due to a problem with the brain or the brainstem or cerebellum? Usually people in their 50s, 60s or 70s, if they come with vertigo, always ask these questions. Do you have difficulty in speaking, something called a dysarthria, any facial numbness or a double vision or any feeling of weakness or numbness of either one side or the other, and the persistent feeling of unsteadiness. This would encompass a transient ischemic attack as well as a vertebrobasilar stroke. So always ask this question regarding their speech, regarding their vision, regarding their limb weakness or numbness or unsteadiness. If these things are present, immediately you should diagnose, you should suspect a central cause, and you have to ask for a MRI or CT brain or other test. Similarly, 40% of the migraineurs, those with migraine, they would come with a vertigo. So they would come with either headache alone or syncopal attack or falls on vertigo. That's a migrainous vertigo. If you treat properly with anti-migrainous medication, they would become normal. So the investigation would be, as I mentioned earlier, a CT scan, or a brain and other relevant tests like sugar, hemoglobin, pure tone audiometry. You should have a close interaction with your ENT colleague. You should ask their help in case if you really want to have the various tests, the Dix-Hallpike maneuver as well as Epley's maneuver, various other maneuvers are there. Because sometimes you may not be that good in treating appropriately, especially all those techniques, the Epley's and other various maneuvers. So always should have a close interaction. So you should have do a direct maneuver after the Dix-Hallpike, or maybe you have to do a Epley's maneuver afterwards, depending on the which canal is affected. Okay. So you should check the blood pressure, correct the anemia, correct the sugar, correct the electrolyte imbalance, and if there are any lesions in the brain and the brainstem and the cerebellum or CP angle, you have to intervene accordingly. You may need a help of your neurosurgeon, and he would operate in case there is a tumor or other condition. So I would like to conclude here by telling you that vertigo is quite common. This may be due to a problem in the ears or in the brain or in the structures in between. This may be various infective cause, inflammatory cause, demyelination, toxic degeneration, trauma or drugs. Many things would cause vertigo. And in elderly, always look out for a central cause like a vertebrobasilar stroke. And young people may be a problem in the migraine, or if the vertigo is prolonged, always look out for the Meniere's as well as labyrinthitis or a central cause. Okay. Thank you. If you have any comments, always you can do so. Thank you very much. Bye.